Dr. Wyckoff with Pathway to Wellness with yours truly, Dr. John Wyckoff. And today's topic is vitamin D. You know, vitamin D is a fascinating substance, and it's referred to as a vitamin. It's also called calciferol, but it's really more of a hormone. It's a fat-soluble vitamin that got tagged a vitamin, but it really does so many things beyond what a typical vitamin would do. We should really call it Hormone D. And vitamin D is critical for over 400 different functions inside your body. So having enough vitamin D, and we're going to talk about what enough is so important and critical for overall health and wellness. Now, vitamin D is made in our skin when we have sunlight exposure. Now, for those of us in Michigan, where I live, that can be a rare commodity, especially from November until May. But there are a few food sources of vitamin D. There aren't many, but you can get vitamin D from foods like fleshy, fatty fish, fish liver oils, beef liver, egg yolks, cheese, and some American foods are fortified with vitamin D, like breakfast cereals and much dairy products, milk and such. You can get some vitamin D by getting adequate sunlight exposure, but that varies by the season, the time of day, the length of exposure, cloud cover, the amount of melanin or pigment in your skin. All of these affect vitamin D synthesis and vitamin D absorption. But vitamin D is critical for making strong bones. It allows your body to absorb calcium. That's the most important single thing that we think of. It promotes adequate calcium absorption in the gut and maintains adequate serum calcium. That's the calcium level in your blood. Phosphate concentration that enables your bone mineralization to be optimal. You know, calcium levels also are involved with muscle contraction and heart contractions, your heart muscle. So having adequate calcium is critical for your health and wellness. We also feel that low vitamin D levels leads to autoimmune diseases, multiple sclerosis, maybe even cancer. So when we don't have adequate vitamin D, we're going to get thin, brittle bones. And in severe cases, we get something called osteomalacia, or maybe something you heard of called rickets. That was in the Christmas story. Tiny Tim had rickets. We don't see that as much today. It's actually something I've never seen, but we do see a lot of osteoporosis, which may be on the same continuum where people just are not getting enough calcium into their bone, enough vitamin D to drive calcium into the bloodstream. We know that vitamin D also controls inflammation, as well as a modulator of cell growth, neuromuscular and immune function, and even glucose metabolism. So if you're having metabolic syndrome, insulin resistance, diabetes, really vitamin D is important to you, getting adequate amount of vitamin D. Many genes are influenced by vitamin D. And most tissues, almost all tissues in our body have vitamin D receptors. Absorption is usually fairly good in the gut, but as I said, only a few foods have any vitamin D in that. So you really do need to get into the sun or take vitamin D in a supplement form. Now, we're going to talk a little bit about vitamin D supplementation because it's so critical for your overall health and wellness. So in general, your amount you supplement should be guided by your blood level, your serum levels. And you should be asking for a vitamin D level every year with your annual blood work. I can make a compelling argument that your vitamin D level is the single most important marker for overall health and wellness that people should know. You know, people come in and say, well, I've got a great cholesterol, or my blood sugar is normal, or my kidney liver function are normal, my TSH is good. But really, those are not indicators of potential health issues. Vitamin D level is. So if you want a blood test that is a predictor, a predicator of potential health issues now and in the future, have your doctor run a vitamin D level. You'll have a number. It's a very inexpensive test. All labs will do this. Ask for it, get it done, and find and know your number. The range of normal for most labs runs from 30 to 60 nanograms per ml. You'll see a number, then the connotation ng/ml. That's nanogram per ml. That's a concentration measurement. And 30 to 60 is a range that's accepted by most labs. And I'm here to tell you it's probably too low. I learned a lot about vitamin D from Dr. Michael Hollick. He's been at several esteemed universities doing research on the East Coast, and he really shared with me years ago that vitamin D does not really activate at a cellular level until the level is above 50.1. Yes, that much, 50.1, not 50.0, 50.1. And since that time, he's actually encouraged physicians to drive serum levels into the 80 to 120 nanogram per ml range. And I'll share with you that I keep my own personal level right about 110, 120 by taking vitamin D supplementation and trying to get some sun exposure and eating some foods that have vitamin D3 in them or vitamin D in them. That's all you need to do. But you've got to take enough. So what is enough? Well, for an average adult who, let's say, weighs 200 pounds, 5,000 IUs of vitamin D. I like the vitamin in the D3 form. We'll talk more about that in a minute. Daily, as a supplement, is all that you need to do. Vitamin D, because it's fat soluble, can actually be taken less frequently. So if you wanted to do 10,000 IUs every other day, that'd be fine. And you can even do 50,000 IUs once a week. That's the form that I use. That's the most cost-effective route. Costs about 3 to 4 cents a day to take 50,000 IUs of vitamin D3 once a week. You don't want to do it once a day. Once a week is adequate. Because it's fat soluble, it'll get absorbed into your body fat, and then will slowly get into the serum as you need it. So taking a once weekly supplementation is fine. Some people prefer that. Some people forget to take the once weekly form, and then the once daily 5,000 IUs is a great way to go. However you do it, it doesn't make a difference just so you do it. And people say, well, what about my children? Well, children should take vitamin D3 also. D3 is the active form of vitamin D, the form that ultimately your body makes after it's transformed from vitamin D1 to D2 to D3. D3 is the active form and the form that does you the most good. Children need vitamin D, and you can roughly estimate that they need 100 IUs of vitamin D3 for every 10 pounds of body weight. So it's not hard to figure out. If you got a 50-pound child, that's 500 IUs, international units. That's how we measure vitamin D a day. Easy to come up with. If they're 100 pounds, that's going to be 1,000 IUs. If they're 200 pounds, it's going to be 2,000 or more. So even kids, newborns can use vitamin D. You can get vitamin D drops. You can dose it down to a drop a week or a drop a day, depending on the child's weight. And talk to your doctor and get the appropriate amount and appropriate concentration. But I had my children taking vitamin D through their pregnancies. I had 3 daughters, and that was very important for the development of the child's brain, the child's immune system, and then had them on vitamin D drops immediately after birth. And then they've continued now as they've gotten into adolescence. So, vitamin D deficiency, especially in breastfed children whose mothers are vitamin D deficient, is really a big deal and can affect so many things with the child's health. So if you got a child who's having recurrent illness, recurrent ear infections, throat infections, who's just a sickly child, tends to get all the viruses, make sure they're getting vitamin D. Vitamin D does so much to support immune function and a healthy immune system. I think that most people in the United States do not get enough vitamin D. It's hard to get it from sun exposure, especially in northern climates. And if you look at the incidence of ADD, autism, anxiety by latitude, the incidence goes up from the equator going north and the equator going south. You see more and more children with autism, ADD, any of the neuropsychiatric issues related to brain function correlate almost directly with latitude and the distance from the equator. So vitamin D is important. We need vitamin D in your diet. You need vitamin D supplementation to get enough vitamin D to prevent bone or to optimize bone health and osteoporosis prevention, heart disease improvement. It can improve left ventricular function, reduce cholesterol and triglycerides. But you've got to get a level that's high enough to do that, somewhere, like I say, above 50.1 nanogram per milliliters. I try to get patients routinely between 80 and 100 nanograms per milliliter, and even sometimes I go higher than that if they're comfortable following it. We really don't know if there's a toxic level of vitamin D. Theoretically, it may be, but I've had patients with autoimmune diseases with levels that run consistently above 150 nanograms per ml, and they do much better at that level. Their symptoms are reduced. So talk with your doctor, get the testing that you need, and get enough vitamin D to be healthy. An area, too, of just going wild in this country is insulin resistance and type 2 diabetes. Vitamin D supplementation can help with glucose levels. And I think if you're pre-diabetic or you're diabetic, that's one simple thing to do is to get your vitamin D level up above 50. Try to get it maybe in that 70 to 100 range, 80 to 100 range. It can help you with weight loss, maintaining adequate weight, help with healthy bones, heart arrhythmias, because you need calcium to prevent heart arrhythmias, and even sudden death syndrome can be related to a cardiac arrhythmia, which can be related to mineral depletion. Some medications interact with vitamin D. So the statin drugs, steroids, diuretics. So you have to watch out if you're taking those kind of medications. Antacids will affect absorption. So eating a healthy, balanced diet, getting some fortified foods in your diet, maybe eating some fatty fish, sardines, things that have fish oil, oily skin fish, you're going to get some of the vitamin D that you need to maintain an adequate level in your bloodstream and optimize your health and wellness. It is so critical for strong bones, muscles, and overall health. We just don't get enough sun. Even in the sunny states, you see about the same incidence of vitamin D depletion or low vitamin D levels. And, we have people that are homebound, people that just don't go outside, people that have had skin cancer, and, rightfully so, they're very careful about the sun exposure. People that are very sedentary, they have low vitamin D levels. I've seen levels in the single digits routinely in my practice. We check vitamin D levels obsessively, and as I said, it's one of the simplest tests that you should get to get you on that path to health and wellness is optimal vitamin D. If you're an average-sized adult, 200 pounds, give or take, you can safely take 5,000 IUs per day. Consult with your doctor. Have him guide you, have him do a vitamin D test. And if at 5,000 your level is still low, take more. Maybe you need 7,000, 10,000. But don't go on real high doses without talking to your doctor and getting your blood tested. If you're a dark-skinned individual, dark-skinned individuals do not absorb vitamin D like more fair-skinned, lighter-skinned people do. Or come see me at Wyckoff Wellness. We're a functional and integrated medical practice in East Lansing, Michigan, 1226 Michigan Avenue. You can find us at wyckoffwellness.com, coffwellness.com, and talk about your health and wellness concerns. We have a wide array of vitamin D3 supplements available at our in-office store or online at wyckoffwellness.com, wyckoffwellness.com. You can click on the Shop Now or Store tab. Just punch in vitamin D3. You'll see the vitamin D3s come up. We have vitamin D3, 5,000, 10,000, some with K2. Vitamin K is fine to take with vitamin D. It actually helps the absorption. So some people prefer vitamin D3 with K2. I don't think it's a huge issue, but if you want a little extra kick, maybe the vitamin D with K2 is a good choice. And get some sun. I always tell people it's okay to get a little bit of sun exposure. Get your skin a little pink. We don't want you to burn. Get some physical activity. Get outside. Get some fresh air. Eat a healthy diet with some foods like fatty fish, eggs, milk, maybe cereal, although cereal's not maybe the healthiest thing. It neither is milk, but you'll get some vitamin D. And then take a good vitamin D supplement like those we have available at Wyckoff Wellness, produced by Metagenics. When you put sunblock on, you're going to reduce the amount of sun exposure. That's good and bad. The sun is not all bad, so possibly some sun exposure is good. So that can be helpful for you. You may not know you have vitamin D deficiency unless you get a blood test. It takes a long time with low vitamin D levels to develop osteomalacia or rickets. But those other health issues we see, like effects on your heart, muscles, brain, immune system, those start out early on. So it's important to know your vitamin D level, take steps to improve vitamin D in your bloodstream, either eating enough foods that are high in vitamin D, getting enough sun, or as we advocate at Wyckoff Wellness, doing those two things plus taking a quality vitamin D3 supplement. Vitamin D is transformed in the liver and the kidney from D1 to D2, D2 to D3. You can take D2 or D3. Both forms are available. It readily converts from D2 to the D3 form. We just advocate using D3 because that way your body doesn't have to do any work at all. The vitamin D is in the most bioavailable form. It's going to do you the most good. So reduce your risk of osteoporosis, falls and bone fractures, especially as you get older, rickets, low calcium leading to arrhythmia, autoimmune disease, depressed immune function. So if you're thinking about, do I have a risk for vitamin D? Well, if you're darker skinned, more pigment in your skin, the answer is yes. If you avoid sun due to previous sun damage, the answer is yes. If you spend prolonged time indoors, and you're not getting the sun, especially if you're like a night shift worker or those people that are in residential care. My parents and in-laws have been through that. They just don't get outside. It's amazing how seldom they get outside. If you can get them outside, even if it's with a walker or a wheelchair, get them some sun. Some people, because of religious or cultural reasons, wear clothing that cover most of their body. People that are obese tend to be vitamin D deficiency. If you have a disability or a condition that affects vitamin D metabolism, such as end-stage liver disease, kidney disease, malabsorption syndrome, such as cystic fibrosis, celiac disease, you may not be absorbing vitamin D, and you're going to need more vitamin D. Certain medications, and we talked about if you're a breastfeeding infant and your mother's vitamin D deficient, you just compound that issue. So see your doctor, talk with them, or come see us at Wyckoff Wellness in East Lansing. Treatment options, if your vitamin D is low, get out in the sun, improve your diet with foods that have vitamin D, and then supplement. And then guide your level of replacement by your blood test. That is so critical. The single most important test, as I said earlier, that you can get today that costs almost nothing, your insurance will cover it if you have medical insurance, is a vitamin D serum level. Just have your doctor get it. It doesn't have to be fasting. Know your number and get a number that's at least 30, but really at least 50. So this is Dr. John Wyckoff. If we can be of further service to you, please look us up. Find us in East Lansing on Michigan Avenue, 1226 Michigan Avenue. Give us a call at 517-333-7270, 333-7270, or find us at Wyckoff, WYCOFF Wellness.com. We're going to be back with more episodes of Pathway to Wellness with Dr. John Wyckoff. So keep listening, keep finding us, and improve your health and wellness today. Get on that path and improve your health and wellness in a natural way.